welcome to South First. I am Sumit Jha. It's an overwhelming moment for me as I am sitting in front of a person whose work I admire a lot. And I don't want to miss anything that he is putting out on Twitter. For many of us, sometimes our elders ask us to do certain things, and sometimes society certainly makes us not question the status quo. One example of this is Ayurveda and homeopathy. When we get sick, our elders bring some Ayurveda product and ask us to consume it. And on other hand, society certainly asks us not to question the practice of Ayurveda, homeopathy, or naturopathy in any form, as they sealed it with a wall of culture, history, and tradition. Today, we have Dr. A.V. Phillips with us, who is a hepatologist and clinical scientist at Rajagiri Hospital in Aluva, Kerala. He is breaking the status quo with his evidence-based scientific work, debunking the narrative of alternative medicine that is quite prevalent in our society. He is a fearless doctor who doesn't give a damn about what people say. On Twitter, he is known as the liver dog. Whatever it is, I am a great admirer of his work and his outspokenness. Welcome, Dr. Phillips, to South First.
Yeah, thank you, Sumit, for having me on your show.
Apart from hepatologist, you are known as in Ayush. Like the recently, in last 3-4 years, this term Ayush has come up a lot. Ayush Crusader, and a lot of your work are related to Ayurveda, homeopathy, and naturopathy, which is published in various journals. Looking at all your works, I might have missed a lot about like your life and where you are coming from. But this question comes very often to me. If there is a personal story behind you going after homeopathy or Ayurveda on what food, is there any personal angle to you about this?
Yeah, I mean, there is a personal angle, and that personal angle is called patience.
Okay.
You know, the patients I see,
Yeah.
and especially children.
Yeah.
So I have been treating a lot of herbal liver injuries and also homeopathic liver injuries since last, 5 to 6 years. And some of these herbal liver injuries are actually all of these herbal liver injuries are avoidable. Because if you ask me, in mainstream medicine, in actual management of diseases, herbal medicines have no role. They are still alternative medicine. If they are not alternative medicine and there is evidence for their use, they become actual medicine and we will all prescribe it, right? But that doesn't happen. So they are still alternative medicine. So in the absence of actual evidence and proof for any benefits, if somebody is using that and develops a side effect because of that, that is actually an avoidable side effect. So when I look at all the herbal liver injuries I see, and the transplantations that we had to do for herbal liver injury patients, or the death summaries that I have to write for my herbal liver injuries patients, I see that they should have been alive now if they did not use that herbal supplement at that time. So they are all avoidable deaths and avoidable liver injuries. So that becomes personal. So avoiding something can actually improve the health in a community. I have to be very vocal about it. So that is how I started talking more on how the alternative medicine practices can actually harm you, and people should actually stay away from it. It is for their own good, not for my own agenda or propaganda. It's just for the public health.
But talking also cost you a lot. Like the day before yesterday, you posted on Twitter that an Ayurveda practitioner had sent you a defamation notice asking you to apologize and remove a peer-reviewed paper. I'm saying peer-reviewed paper published in Oxford Journal. Otherwise, you would face charges amounting to 1 crore. Moreover, yesterday I saw an ad for Herbalife on boundary lines during an IPL match. Herbalife is one of the companies that threatened to sue you. And you also alleged that because of their threat, one of the leading publishers removed again peer-reviewed publication from their side. How do you perceive these companies and practitioners threatening your work as a clinical scientist? Leave that. Moreover, leaving these aside, organizations like Homeopathy Association in Kerala have registered a case against you, and Ayush Ministry summoned you. So, how do you see that this kind of threat from individuals, companies, and as well as institutions like Ayush Ministry?
If I want to answer the first part of that, I mean, looking at individuals and Ayurveda companies and companies like Herbalife. So Herbalife is not Ayurveda. It's basically herbal and dietary supplements company. It's a pyramid scheme and a multi-level marketing.
Yeah.
So if you look at those and they coming after me, it's purely the business aspect of it.
Okay.
Their businesses are getting affected. That is the only reason. It is not because their product is effective. It is not because their product is saving lives. Nothing. It is just because they are losing money when the truth comes out. And that is exactly why they come after me. But when you look at institutions
Yeah.
like the homeopathy organizations or Ayurveda organizations or the ministry coming after me, that is to maintain that particular, they have to maintain their value within the community. So
Mhm.
Ayush Ministry or any Ayush related organization is supposed to promote their practices, and their practices are not purely not at all based on clinical evidence, but actually based on traditionality, cultural values, and also nationalism. So Ayush
Okay.
Ministry can never say that Ayurveda is useless. They can never say that Ayurveda can harm you. They can never say that because they are there to promote it. And it has a big nationalistic appeal and it's part of the Indian culture and tradition. So they will never say, from their own point of view, that even if you provide them evidence, they will never accept it. And if you provide evidence and you talk about the evidence that you have, definitely they'll come after me or come after the person who's doing it because they have to protect that identity. They have to protect the businesses. And there is no other way that they can go about it. So if it was a fair world, what they would do is that they would actually show me evidence that their therapies work, or they would show me evidence that my publications or my evidence is actually wrong. But they're not doing that. Instead of that, they're actually coming after me with harassments and litigations and legality. So this itself shows that they're protecting their identity and business and nothing else. So this is the way I see it.
Like, you are a clinical scientist, and there are these people who practices Ayurveda and homeopathy. So I just want to know, like, how does Ayurveda work on our body? Is there any evidence? Is there any scientific method where we can determine that, okay, Ayurveda works in any form? Is there any way to determine it?
So, I mean, if you go by Ayurvedic principles, there is no way because Ayurveda is a pseudoscience. And I can say this anywhere because if you look at the principles that guide diagnosis and treatment in Ayurveda, it is something known as the Tridosha theory,
Yes.
right? So it's an old obsolete humoral theory based on Vata, Pitta, Kapha and all that. So if I ask an Ayurved, please show me Vata in a patient or Pitta in a patient, please show me, measure and show me, they cannot because it's actually one of those theories that you imagine to be. It can never be in real life. So the whole Ayurvedic principles are based on pseudoscience, which means that you can never ever prove that any of the Ayurvedic therapies or diagnosis actually works based on their principles. Now, what we can do is that we can test their therapies. So we have these Ayurvedic formulations and we test them with respect to symptoms or any disease conditions as they claim. And we can show that if it works or not. Now, very important is that when you actually test these Ayurvedic therapies, for example, I'll take the example of Chyawanprash. So Chyawanprash is something that we have been having since many, many, many years for immunity building and things like that. Children take it, even adults take it. We have a diabetic version. We have many flavors in it. But ultimately, there was a study which was conducted by Ayurveda practitioners themselves and published recently about a couple of years back on Chyawanprash, a randomized trial, which showed that Chyawanprash does not work at all in improving immunity or does not do anything at all. So basically, when you subject them to actual scientific method, all of these alternative medicine therapies will actually fail because they are based on pseudoscientific principles or imaginary principles which we cannot actually test in real life. So that is the reason why I say that Ayurveda has no science behind it. Even if there is a science behind it, that's a pseudoscience. It's not real.
Okay. If may I ask, how many cases are registered against you or for doing what you do, doing your own work?
I cannot actually give you exact numbers, but there are a couple of FIRs. I have received more than 5 legal letters. I have received letters from the Ayush ministries about maybe 6 or 8 times, from homeopathy institutions about 5 times, from my own council, medical council, about 4 times. I mean, it's the number's huge, and I think it just gets built up. It does not end. I think it keeps on increasing the more evidence that we bring in.
Okay. No, so you have mentioned the medical council. So recently, the NMC had a joint meeting with Ayush, homeopathy, and Unani to decide on integrating all the systems of medicine together. And it is also pertinent to note that there are PIL in high courts that advocate that seeking integrative medicine to be implemented in our normal medical normal life. So I want to ask you this question. While like previous MCI rules did not permit mixopathy, now NMC in there one of the section has officially permits the mixopathy. So what is your stand on government's approach towards mixopathy? Because one hand, Ayush Ministry at center, they are promoting it. On other hand, we are also seeing that this is causing harm to us. This is causing harm to the patients.
See, I mean, if you look at integrative medicine, it
Yeah.
is definitely not a sign of a scientifically progressive country. So if you look at all the scientifically progressive countries, I mean, you take the US or you take any country in the Europe, they don't have an integrative medicine system. That is because they are progressing. They are progressing with science. Countries like India, where we are still developing, and we actually have a lot of gaps to fill. We try to fill those gaps with half-baked ideas. So one of that half-baked idea in healthcare is integrative medicine. When you cannot actually provide real good healthcare, quality healthcare, equal healthcare to the people, you actually come up with such really obnoxious and I would use the word really nonsensical ideas of integrating systems together. It's like buying a car and tying two bulls in front of it, and instead of starting the engine, asking the bull to you know take the car forward. That's integrative medicine. That doesn't work actually in a scientifically progressive society. And I think the reason why this has been done is to promote traditionality, nationalistic appeal, cultural values, and things like that. I don't think it is done to actually improve the healthcare, and this is a fact.
But more often, I have also observed that many of the doctors who practice modern medicine, they also ask to integrate these Ayurveda. Like I'll give you, I have one example. So during Delta wave, when I was diagnosed with COVID-19, I was recommended ivermectin tablets, and after a few months, the updated guidelines removed this medicine. But when I again got tested positive for COVID-19, the same doctor recommended it. I don't know like why did he read that guidelines or not? I'm not sure about that. But we have seen that that same doctor has recommended to eat chawanprash. The same doctor has recommended me to have hot water along with black pepper. And somehow I didn't do that. My question is that I'm not sure about the doctor's life, how they live their life, because every day they might be seeing hundreds of patients and they don't update themselves with the kind of practice follow. But you are a scientist, you have to be updated with the literature. How do you see the practice of modern medicine along with this integrated medicine? Because I'm not able to find many doctors coming up with only the modern side of it.
See, I mean, modern medicine doctors actually integrating or advising these traditional medicines along with their treatment.
Yeah, yeah.
If you ask me, I think they have wasted a medicine seat. That is not supposed to be the real medical practice. They are mostly ignorant, they are not updated, and they are not curious. And a lot of them are actually are driven by their own cultural biases, traditional biases. So that is why they ask people to, take some herbal decoction along with paracetamol and things like that. So I think a lot of Indian doctors suffer from this. So they know they are trained in scientific medicine, they practice scientific medicine, but somewhere deep inside they are also having some appeal towards the traditionalistic and culturalistic aspect of medical care. And I think it has to go away. And the only way it can go away is when doctors are more scientifically oriented and their scientific temperament actually improves. Because see, there is the whole aspect of clinical medicine, which is based on clinical evidence. So once you have that focus on clinical evidence, then your clinical medical practice becomes very easy. Actually, you don't have to be confused. You don't have to confuse the patients. So these doctors who actually don't follow clinical practice or clinical evidence in their practice are the ones who keep prescribing ivermectin for COVID when it's absolutely a useless drug for COVID, and prescribe a lot of these traditional medicines for for various diseases without knowing anything about it. So I think I have come across many such doctors on Twitter, and they actually abuse me because most of them are very nationalistic. They're proud Indians who love Ayurveda and homeopathy and things like that, and they just do it just to get they just do it just to trigger. You don't have to bother about them. But in clinical practice, somebody is doing that. I would stay away from such a doctor. I would not want somebody like that to be my doctor who would tell me to do both.
I think the time is getting over, but I really want to ask a last question from you. As a person who is going to see a doctor, what should I expect from a doctor? What should I look forward when I see a doctor?
So I think in a single sentence, I would answer it the way that doctor should explain it to you.
Okay.
It's not just about prescriptions, but it's about what that particular disease is all about, how it is going to go, the natural history of the disease, what are the treatment options, and what options that I am giving you, and what I expect from that treatment options that I'm giving you. I mean, I think a doctor who spends time with the patient explaining the disease and explaining the disease consequences and the treatment to prevent those consequences is the right person to actually take healthcare advice from. Somebody who, I mean, many doctors can't do that, and I accept that because in India we have to see a lot of patients. But I feel that still doctors can give crisp, clear answers that help the patient understand about the treatment and the disease, and that is exactly what you should look for.
Thank you, Dr. Yabi. It was quite insightful to know about your work. For me and hundreds of people like me who always look towards your Twitter handle where you put information about alternative medicine and so on. It was quite insightful to speak to you personally. Thank you for speaking to us.
Thank you for having me.